Hello, I'm Dr. Rex Luttrell. Thank you for joining us today for this online seminar. I'm going to present you with some information that will help you make an informed decision about having lap band surgery. First, we're going to start with what are the perceptions of obesity. The body mass index is a mathematical term that we know about today. It's been in the news, you hear about it. If we look at this slide and look at the class 2 and the class 3 individual, these are the individuals that we tend to operate on. The body mass index is a mathematical calculation, and we get that by taking your height over your weight, and it gives us a number. And you can see under morbidly obese, a number of 40 or greater defines what morbid obesity is. This slide here shows that as one's BMI increases over time, your mortality rate goes up. And it's not that people die from obesity per se, but they die from these commonly listed diseases that you see on this slide. The impacts of obesity are tremendous, both financially and still very commonly people are discriminated against because of their obesity. But on this slide, you can see that the more obese a person is, the more healthcare dollars that it takes to take care of them, and it's based on the diseases that we listed on the last slide. What are some weight loss strategies? Well, we talked a moment ago about diets and exercise. They're very important with a lap band, but we know diets and exercise alone are ineffective for most people long term. Behavior modification, there's a small subset of patients that have a true psychological issue with eating. These are things that we have to discover and talk with the patient and potentially even get some psychological intervention before proceeding with surgery. Drug treatments have been very common as uses to help people lose weight, but we know that drugs long term, they don't work and they're not without risk and side effects. Then that basically leaves us with weight loss surgery. Through all the studies that have been done over the years that bariatric surgery has been done, it has been shown that weight loss surgery is the most effective long-term solution for weight loss. The two most common operations today for weight loss surgery are the gastric bypass procedure and the lap band. Now, very briefly, the gastric bypass has been around for many years. What is most evident about this operation is you can see that cutting the stomach in a couple of different places, bypassing the small intestine, you're doing a tremendous amount of surgery here. That also increases the risks that people have, both immediate and long term. The other significant factors that one has to be worried about with a gastric bypass are the nutritional deficiencies over time, and basically that this is a non-adjustable operation. Once it's done, it's done. And whatever you end up with as a result of the bypass, that is what is going to serve you from now on. Now let's talk about the lap band. You know, what I like so much about the lap band are the advantages. We don't staple or cut anything. The complication rates are very low. A woman who becomes pregnant may have to have the band loosened up. It's a very easy process to do, allowing that person to go through pregnancy, come back later and get the balloon reinflated. It's very reversible. We do consider the lap band a forever procedure because we know that if we remove it, even when people get down to their appropriate amount of weight, that their weight could come back over time. But it's a very quick and easy process to reverse this procedure, a matter of going in, unbuckling the band and removing it. It's minimally invasive. We do it through 5 puncture holes that are clustered in the upper abdomen. It takes about 45 minutes to do the procedure. The other wonderful thing about the band is it produces satiety. In other words, some people have that hunger feeling all day long. And when the lap band is put in place and it's inflated, it completely takes away your appetite. For the most part, the lap band procedure is an outpatient operation, and if a patient needed to stay overnight, they certainly could out of safety reasons, but it is unusual. Now, if we look at disadvantages, they're very few with a lap band, which is what I like so much about this procedure. The weight loss comes off a little bit slower than maybe a gastric bypass procedure, but it's more physiologic. people do better long term with a little bit slower weight loss. Follow-up care is critical. We know that the most successful patients in our practice are those that come back when they're asked to come back, so that we can go over eating habits, how you're doing with the band, are you really living in harmony with the band, which is what you will learn as time goes on. The band is made out of silicone. It is an implanted device, but it's very body friendly. Silicone's been used in applications for over 50 years in surgery. This slide here shows what the lap band looks like in place. Once we do it laparoscopically, about a 45-minute procedure, you can see that there's a small pouch above the band. That is the new stomach. And with that small stomach, what we're able to do is, with a small amount of food, allow the patient to fill up very rapidly. So when you eat, the food will sit in that pouch. It stretches the wall of that pouch, which sends a nerve signal back to the brain that says, I'm full. So that's how people lose weight with a small amount of food using the lap band system. Okay, if we look at some of the complications of a lap band procedure, you can see, comparing the band to the bypass, what those numbers are. And what I love so much about this operation is, again, it's a very safe operation, done for the most part as an outpatient, but you can see what the numbers are comparing the band to the bypass. If we look at this slide and recovery times, you can see what the band versus an open bypass to a laparoscopic bypass is. And I would say, in my experience, that most people within a week's time are completely recovered, they're back to work, and they're doing very well. If we look at this slide, this compares the laparoscopic gastric bypass to the laparoscopic adjustable gastric band. And you can see that over a period of time, this is a 60-month period, that both the band and the bypass have equivalent weight loss results. This slide just shows that out of 68 patients, 62% of these patients maintain good weight loss over a 36-month period. Now, what would make you a candidate for the lap band system? Well, if you're an insurance patient, they're going to look at the BMI very closely. A BMI of 40 or greater is what most insurance companies are going to go by. If you're self-pay or by other means, we can relax that criteria just a little bit because we don't have the constraints of insurance. Occasionally, insurance will look at you with a BMI of 35 or greater, depending on the number of health issues that we've already talked about. The band is indicated for 18 years and older. It's approved by the FDA for that age group. Most people have been overweight for a number of years, but after a lap band procedure, or any bariatric operation for that matter, follow-up care is critical, and support. You've got to have the appropriate amount of support so that you do well long term. And being around other people who've had the same procedure, getting online, doing online support, or what have you, is critical to doing well with this operation. Before and after pictures are great. This is a patient, Robin, who is what she looked like before her lap band procedure. And this is Robin after she's lost 150 pounds. It's amazing how well people do post-operatively. We all know people who have lost weight. If you see Amanda here, Amanda is pretty dramatic in weight loss. This is Amanda before her procedure. This is Amanda after her lap band procedure. A little bit ago, we talked about the cost of obesity. This is a particular patient who spent over $18,000 a year just maintaining their obesity. You can imagine with a lap band, which is going to help you decrease your food intake, that amount of money that a person would spend there is going to decrease. If you're on prescription medication, one of our goals with the help of your family practice physician is to get you off prescription medication. Once you do that, that amount of money is going to drop. We know that there are many commercial weight loss programs out there. Well, you're going to have the ultimate weight loss solution, the lap band. That amount of money is going to drop. And then looking at all the other healthcare expenses, the inactivity costs that so many obese patients suffer with, you can see that that amount of money is going to drop. So if you look at this from a financial standpoint, you can see that both physically and financially, it's a win-win situation for having a lap band procedure. Now, what about financing? Unfortunately, insurance doesn't cover the lap band in a lot of instances. We do work with several programs, Care Credit, surgery loans, Capital One. We'll be happy to help you get financing. Your next step is going to be to contact your insurance company to find out if you have a covered benefit or not. I've been involved in the practice of bariatric surgery for over 15 years now. When I was doing gastric bypass procedures, I did probably 1,000 of those. We've done over 700 lap bands now. I feel like we've got very good outcomes. I feel like we've got very happy patients, and we really take a personal approach. We really look at our practice as sort of a boutique type practice where, you know, our main goal is to help you lose weight. If we're not successful, then you're not going to be successful. If you have a problem, we will get you in that day. Our goal is to take good care of you. We look at the whole aspect of obesity as psychological, physical. We look at any other factors that we might need to correct to help you be successful. That's why I think we do a good job with the lap band procedure. I'm Dr. Rex Luttrell with Luttrell Surgical Associates. Thank you so much for joining us for this online seminar. Please use the contact information so that we can help you further in your journey.